think we have a number of challenges. Number one, we have achieved pretty good standard in some parts of the world, and we'll have to distribute this to the whole globe. Number two, breast cancer is not breast cancer, and we learn increasingly that there is many different subtypes, and some patients will need more treatment and treatment escalation. Other patients will need treatment de-escalation because in order to preserve their quality of life. So individualizing the treatment from the subgroups that we are treating now to the true individual person, that's the main challenge of the future, and eventually achieving cure. That's what we want to do.
This is very interesting. I think one of the main topics would be to screen the patients after surgery, probably differently from what we do today, and use molecular markers like ctDNA and these features. This will be used much more often than today. And of course we would like to see if we could treat patients based on the molecular profile of the tumor more individualized as before. The data we have seen so far do not show that, but I think with more detailed analysis and more detailed and more targeted agents, we could do so in the future.
That is a very large question with which I could spend hours about talking. I think what we're seeing right now is that we have new development of exciting agents like the ADCs in the metastatic setting, and we now need to integrate them into the early breast cancer setting, and also the other new approvals that we've had recently in the metastatic setting, integrating those drugs in the early breast cancer setting will probably, hopefully, lead to less metastatic disease overall, which I think is going to be a major step forward. But I think beside new drug development and new systemic therapies, I think a major issue in the global perspective is how can we guarantee access for patients to these innovations around the world and not just in individual countries and regions.
Well, I think we've come a remarkable distance. I mean, from the time I started with breast cancer to what we have now. But I think to conquer breast cancer, I think that there are two major goals. Number one is how to cure metastatic disease. Now, you heard today, from Ian Kropp, how one of the goals he has is to develop actually a clinical trials to ask that very specific question, that when you have a person with metastatic disease, can you develop a therapeutic regimen that will actually cure their metastatic disease? I think that if we have a tool to get at that, then everything will follow downstream. Because if you have something powerful enough to kill all cancer cells in different niches, then that same therapy should be equally powerful to cure a small cancer present in the breast.
Well, the future will bring a lot of positive things for patients with breast cancer. We realized after decades of treatment that we might be over-treating a lot of patients. So just once we realized that, there is a very strong movement to optimize or de-escalate the treatment which we have been giving to a lot of patients. For instance, we used to give radiation for 6 weeks for all patients, then we went down to 3 weeks, then we are now doing a lot of patients 1 week. So the comfort of the patient and the convenience for the patient became very important to us. And this is something we study. Quality of life, we care about the patient quality of life. We care about any toxicity or side effects which happen from the treatment, and we always try to minimize that, because treating breast cancer now became so successful, and there is a lot of hope, and there is always a lot of discovery. Every year there is new drugs, new discovery, better results. The field is going really in an amazing, very optimistic direction.
Well, my advice is think big, There's much more possible than you believe. When I started surgery, I would have never thought where my career would lead to, both in terms of working internationally, also research successes, and being able to treat many, many patients. Work hard. There is no easy way up. It's necessary to invest all the energy, but also enjoy what comes back from patients in terms of being grateful and enjoy the most wonderful profession there is, and that's surgery.
Well, young doctors should find first their passion, and if their passion is breast cancer, they should try to find another passion within breast cancer, because then they are very good and they have something to work on, because the literature is so massive that it's very difficult to follow every single aspect of breast cancer. They should work in a large multidisciplinary team to learn as much as they can in breast cancer. I think this is very important to serve the patients right. And last but not least, they should participate as early as possible, even as a young investigator in clinical trials, to improve breast cancer treatment in the future.
Yes, I think oncology is a great field, and I think we see a lot of progress, and so we need a lot of young doctors with dedication to their work and interest in scientific advances. So please join the field of oncology and work in breast oncology.
I do think that in this day and age where science is so complicated, certainly much more complicated than when I first started out, almost like you have to be an immunologist, a molecular biologist, a genomicist, a pharmacist to even make a dent in cancer therapeutics and in cancer research. My only suggestion is to be patient, because it'll take a little longer because you have to assimilate so much information, but the power of our technologies and the capabilities are so remarkable today that you have an opportunity to make an impact far beyond what I have done in my lifetime. And so I would be patient and I would be persistent. And very importantly, don't be parochial. In other words, don't just focus on your own little niche, but actually think broadly. Accept a lot of science and absorb it the best you possibly can. But when you act to do your own research, whether it's in a clinic or in the laboratory, you need to focus.
Yeah, I want them to be passionate about what they do. I want them to be inspired by patients. I want them to look at their job not as a job, but as a mission in life, that you are born to help patients, to help people, in particular patients with cancer, to give them a lot of hope and to move with them through their journey, and they will never forget you.